Hello, I'm Alex Metricarti, Chief Marketing and Public Relations Officer for Living Branches, and today is Thursday, August 6th, and I am not here today with Ed Brubaker, our President and CEO. The questions that we've received this week are almost exclusively about the new released guidelines for visitation and other questions around the guidelines that were released this week. So you had specific questions, and Ed and I decided that probably this is something that he doesn't need to give you his philosophical take on those answers. So I'm going to be here answering some specific questions that families and residents have sent in with regard to the revised pandemic guidance that was released this week. And I think I'm going to go ahead and start with personal care, memory care, and health care. Just to give you a little bit of background as to how our process worked with this. The state has released various guidelines about what you can and cannot do as far as visitation, dining, activities, those types of things. So our directors of personal care, health care got together and we worked out how we would be able to meet the state guidelines and be as the least restrictive as we could possibly be for our residents. And so after about a month of going through and understanding exactly what the guidelines meant to us, we were able to release that guidance last week. It was an interesting process for me from the standpoint of I really hadn't been in a lot of discussions before with the directors of those levels of care. And I was really impressed, frankly, at how much concern they had for the well-being of our residents. I know that I've had communication from multiple family members over the last couple of months saying, you don't understand. You know, my mom's declining. My dad's not doing well. I know that they're lonely. I need to get in and see them. They're not doing well in this environment. And I heard exactly the same thing, really, from our directors, who are so concerned about the effect and the impact of isolation on our residents. And they're really wrestling with how do we balance keeping them as safe as we possibly can with also doing the things that we know that are so important for their well-being. So I was really privileged to be a part of those discussions to understand just how much thought has gone into this. So the one area in the revised guidelines where we've really seen an increase in what we're able to do is with regards to visitation. So the new guidelines start August 10th in Souderton Mennonite Homes and at the Willows, and they will start also on August 10th for residents who are living at Dock Woods in healthcare. In Oakwood Court and in Harmony House, the revised guidelines go into effect on August 12th. And this change in date for those two areas is based entirely on when they had their last round of COVID testing. You have to be so many days after that, according to the state guidelines. But whenever the campuses are able to open up, what will be happening with the visitation now is that we have the opportunity to have 45-minute visits instead of 20-minute visits. And we can now have up to 4 adults and the children from that household visiting at one time. The caveat with the kids is that they do need to be able to follow Department of Health instructions, which essentially means that if you tell them not to run around and hug their great-grandmother or great-grandfather, they need to be able to follow those instructions. But now we can have visits of up to 4 people, 4 adults and the kids in the household. And those visits don't have to take place behind a chat box. The chat boxes are certainly still there if you want to use them. That's fine. When you sign up on the website for your visit, you could indicate if you wish to use the chat box. But if you do not, you'll be sitting in chairs that are 6 feet apart so that social distancing can be maintained. We also will have gowns available that you as a visitor can wear. And if somebody is wearing this gown, then that would enable you to have short physical contact with your resident. We had a lot of conversation about this in our subgroup when the directors were deciding how are we going to be able to safely allow visitation. And there was a lot of concern for being able to allow physical contact because it is so important. And we do feel that if the person visiting is wearing a sterile gown, has just sanitized their hands, and of course is wearing a face mask throughout, that we do feel comfortable that hugging your loved one is something that can be done safely. So we're very excited for that because we know how much the residents are missing you. Another change that's happening with visitation is that if it's inclement weather, we will now have the opportunity to have visits inside. This will be in a common area, not the residence room at this time, but in a common area. So we're pleased that we won't have to necessarily cancel if the weather is bad. One thing to note with these inside visits, there may be restrictions on the number of persons that can be in the room because we still, of course, have to maintain the 6-foot physical distancing in the room. So if you have a larger group and it needs to move inside, you might not be able to have everyone come to the visit. So just be aware of that. The other thing that's different entirely with the visiting is that per the state, visitors are now required to sign in and sign out after their visit. So when you're coming to the screening station to be before your visit, you will see both the screening form that you'll sign that indicates if you've been around anyone who's been exposed to COVID, that type of thing. But then you'll also have a separate sign-in sheet that you'll need to sign that's indicating your name and then who you're coming to visit, what level of care, and then you'll sign out again when you leave. So a few changes with that. But all in all, we're really pleased that we're going to be able to really double the amount of time that families are spending together. Couple of things also to note about what's happening in personal care, memory care, and health care. We are working our way back towards group dining, if you will. So we'll be having residents come back to the dining rooms. We will still, of course, be having physical distancing. So in order to accomplish that, in some cases, there might be 2 seatings for every meal in the dining room. And in some cases, they might be using auxiliary spaces for dining now. And there's a couple of cases where they'll be doing both of those things. But we're pleased that residents are going to be able to at least not have to dine in their rooms anymore. So they'll be coming out into a group setting. We'll also be adding back in more group activities. Again, everything properly physically distanced. This will include worship services at this time. We're working to start in-person worship services in each area, which is something that we know will be very important to residents. Another question that I've gotten this week from family members is, it's great that you're changing all of these guidelines. When will I be able to have my loved one come home for family dinner? That's something that there's still no provision for at this point. Right now, we don't have any guidance from the state as to when that might be able to happen. We will continue to look for it, but as of right now, really the reasons that that residents would be leaving campus if they're living in personal care, memory care, or health care would be for medical visits, that type of thing. If there's anything else that's going on, you really need to speak with the director in your level of care to understand if provisions might be made. So I've also had a lot of questions this week from residential living residents asking about things that are changing for them. And so as we consider residential living, all along, the restrictions have been a little bit looser there, obviously, because we don't have any state licensing bodies necessarily telling us what we need to do. So we've only been following the general pandemic guidelines released from the state of Pennsylvania. So however, what will change a little bit in residential living is if your family member is coming in to visit you through the screening station, which they should be doing, especially if you live in an apartment building, they will also need to sign in and sign out with that sign-up sheet. We had previously said for those indoor visits too that you're only looking at 2 family members. Now, of course, it could be up to 4 adults and the kids also in that household. So lots more visits there. We are asking in residential living that we not have family gatherings taking place on campus at this time. I've gotten a couple of questions about, birthday parties or memorial services, things like that. And we are really trying to limit the number of persons that we have on campus so that we can reduce any potential spread. So we are asking that you not have family gatherings at this time on campus. Had a lot of questions also this week about card playing and other games like that. We're not going to be starting back up like group card night and group game night, that type of thing. If you want to have a card night with friends in your residence, of course, you're very welcome to do that. Some good guidelines for that would be, of course, to please, please, please make sure you're sanitizing your hands very well, perhaps even in between games. You want to wear face masks, and if you are playing cards, try to sanitize those cards even. But yeah, if you're wanting to do that in your own residence, of course, that's up to you. But we won't be having group activity game nights like that anytime soon. I also had a couple of very good conversations this week with residents who were really looking for advice on the best way that they could be traveling safely with family members. And I want to make sure that you know that we are here if you have questions. So if you're trying to figure out what's the best way for me to do this, or my family is, going down to the shore, should I be going with them? If I do, what would that look like? Please don't hesitate to call your social worker, your director. You can call me, whomever. Talk to your ED, really to just be a sounding board and give you some suggestions. I talked to one person whose family was getting ready to take a trip up into the mountains, and we ended up talking it through. And even though the persons that were coming to visit this resident were coming from states that were on the Pennsylvania quarantined state list, which I think was causing her a little bit of anxiety, we determined that because they were going to be in separate houses, that if she was very intentional about making sure that their only interaction was outside and everybody was very carefully wearing face masks, that she felt comfortable that she would be able to make that trip. So if you've got questions about those types of things, of course, we're here to help you. Please do remember that the state quarantine list does exist, and that we at Living Branches are not allowing persons who are traveling from one of those quarantined states onto our campus. I know we've had a couple of calls from the screening stations about people who were coming up from Florida or Alabama or places like that. So just remember that as you're thinking about family visits. I've also had questions about quarantining. We're not right now having a required quarantine for residents in residential living if they're coming back from vacation. I guess the one thing I would say to this is, Living Branches has always been a community where we look out for one another. So the activities that you've participated in, who you've been with, whether or not there's a potential that you might have been exposed to the virus. And we would ask that if you think that there's a potential that you've been around someone who is from a state that has a higher infection rate, or if you've had unprotected contact, or if you're just concerned that, maybe I did have a higher risk of transmission, please act out of the abundance of love and concern that I know that you have for your neighbors. And if you're in a situation where you think, I'm just not sure right now, please don't hesitate to stay away from other people. I don't necessarily want to use the word quarantine in that situation, but if you're concerned, there's nothing wrong with saying, you know what, I'm going to be in my residence as much as possible because I don't want to take the risk of infecting someone else. We residents always look out for one another. That's one of the things I appreciate so much about being at Living Branches. And I think even now in this situation, even more, we want to make sure that love and concern for each other is coming out in new ways, including not infecting each other potentially. I hope this is helpful. If you have more questions, please remember that you can email questions to me at coronavirusquestions@livingbranches.org. The coronavirus hotline is still in effect, and you'll see the number for that across the bottom of your screen. You can certainly call the hotline and ask questions. You can talk to the social worker or the director in your level of care. And of course, there's information on the website. All of the revised pandemic guidance is on the website now at livingbranches.org/coronavirus. You can find it through there, as well as the sign-up sheets for visitation. So hope this is helpful. Again, thank you so much and have a great day.